Uterine fibroids are benign tumors of the uterus, and they mostly affect the woman during their reproductive years. In India, the incidence of fibroids is around 40 to 60%, whereas the incidence in other ethnicities, such as African American women, is as high as 80%. So uterine fibroids, they are more prone in women who have African American ethnicity, and in the age, it's more prominent in women who are in the age group of 30 to 40 years. People who have early menarche, so around 10 years, 9 years who have started, there's a more risk of having uterine fibroids. People who are nulliparous, that means they do not have any children, they're also high risk of developing uterine fibroids. Genetic factors and a family history of fibroids also increases your risk of getting a uterine fibroid by 2 to 2.5 fold. Other factors such as obesity, high blood pressure, excessive intake of caffeine, red meat, and alcohol, and high sugar substances also increases the risk of you developing uterine fibroids. So we should all understand that uterine fibroids are benign tumors, and they are actually formed by cells which are monoclonal in nature. And we have to know that the uterine fibroids also have estrogen and progesterone receptors on them. So they are highly dependent on the hormones which are released by us. That's why they are more present in people who are in their reproductive age group and not in women who have attained their menopause. They also increase in size during pregnancy and all due to the above reason. So coming to the symptoms of fibroids, majority of all women who have fibroids are asymptomatic. They only have an incidental detection during a regular gynecological visit and during a routine ultrasound which is being done to them. So the women who do have their symptoms, the most common symptom is heavy menstrual bleeding. So heavy menstrual bleeding, it varies from woman to woman. It might be the number of pads she changes or the number of days she bleed, or maybe it could be associated with passaging of big clots. So these symptoms all lead to development of anemia in her, which can cause to other serious complications. The next most important complication is pelvic pain. So women have a lot of dysmenorrhea during their periods and all due to the presence of fibroid. So these two are most commonly present in women who have intramural and submucosal fibroids, which I'll be getting into detail in the next slides. So the heavy menstrual bleeding could be because of increase in the surface area of bleeding inside the uterus, and also it could be because of the irregular contractility of the uterus. So the next complication which affects a lot of women right now is infertility. People who have fibroids within the uterine cavity or intramurally within the uterine wall, they are not, the risk of not getting pregnant is higher compared to the regular population. So if there is a submucosal fibroid which is present inside the cavity, that means that there is no space for the blastocyst to implant. The other complication, if the location of the fibroid is near the cornua, the transport of the sperm up and then of the embryo coming down and all will be affected. So it might cause infertility in patients too. During pregnancy also, fibroids will play a role in having various complications. In early pregnancy, the fibroids can cause miscarriages and lower abdominal pain, whereas in the mid-pregnancy, a serious medical complication called red degeneration, which causes excruciating pain for the woman due to the rapid increase in the size of the fibroid due to the hormones, can be caused. And in the late pregnancy, we can see that we have noticed complications such as IUGR, that is restricted growth in the baby, preterm delivery of the baby, and preterm premature rupture of membranes. These all complications can also be associated, and during labor also dystocia can be noted. Other symptoms such as pressure symptoms, that is frequent urination, incomplete voiding, constipation, and back pain can also be noted in these women. So coming to the location of the fibroid. The fibroid location is the most important factor which decides what kind of treatment we are giving to the patient. So broadly, the fibroids can be divided into three main groups. One is submucosal, which is present inside the uterine cavity, intramural within the myometrium, and subserosal are outside. Basically, all fibroids do start as intramural fibroids and they migrate. So there's a classification from 0 to 8, depending on the location of the fibroid. So the initial 3 are submucosal, later intramural, and the subseral, depending on the mixed component with each other fibroid. So the 8th one is the others, which are the fibroids which are unique. So those include cervical fibroids, fibroids in the cervix, parasitic fibroids. So the subserosal fibroids which have a stalk, they can be separated and they can develop a blood supply elsewhere and go ahead, such as broad ligament fibroids and all. So the 8th category comes into special types of fibroids. So how do we diagnose a uterine fibroid? The first important thing is a physical examination by your gynecologist, which is a pelvic examination, which is much important. A pervaginal examination will give us an idea on how big the uterus is, if there's any palpable mass, or how the mobility of the uterus is. The other imaging modalities which can be used are, the most important one and the first line one is ultrasound. Preferably a transvaginal ultrasound is used for women to detect fibroids, and a saline infused sonography can also be used. MRI can also be done for women who need to undergo myomectomy and to map the fibroids. So there are some fibroids which will be very small, which cannot be picked up by ultrasound. So MRI plays a role in them so that we can know how many number of fibroids are there and where they are located. So we can plan the surgery and we can have a better outcome for the patient. Next, how do we select the patient? So there are factors that influence the choice of treatment for uterine fibroids. The factors include patient age, desire for fertility, and severity of the symptoms. So younger women would preferably go for medical management or minimally invasive procedures. People who want to go, who are infertile and the desire future fertility, they would be going for myomectomy or non-invasive procedures. And if the woman has severe symptoms, or she's going into severe anemia, or the fibroid is very big, causing her pressure symptoms and her leading into hydronephrosis, they might require a more aggressive treatment and they would be requiring definitive treatment. So each, the patient should be tailored. The option should be tailored for each patient, and we should go for a proper selection of the treatments. So the treatment options which are available are, first one is the expectant management, medical management, surgical management, and minimally invasive procedures. As majority of the women who have fibroids are asymptomatic, expectant management is the choice for them. So all we do is wait and watch unless she develops symptoms or the fibroids do grow in size. That's the time when we intervene. Otherwise, we just keep her on a constant follow-up. The next option would be medical options. Medical options. So there are two types of medical options. One is non-hormonal and hormonal. Non-hormonal options are given to women who have mild symptoms, small fibroids, not affecting her physical condition. So if she does have mild pain, NSAIDs would be the treatment of choice for her, which include ibuprofen and mefenamic acid. Whereas if she has only mild, like excessive bleeding, not causing her hemoglobin to drop and causing her to go into anemic status, then tranexamic acid would be the option of choice for her. Next, coming to the hormonal therapy, combined oral contraceptives, progestins, levonorgestrel uterine devices such as Mirena and GnRH analogs are the treatment options which we have. After the progestins and Mirena have come into usage, the usage of oral contraceptives and GnRH analogs have been decreased.